You are listening to the Fitz and Healthy podcast. I am your host, Dr. Lauren Fitzgerald, also known as Lauren Fitz. I'm a medical doctor, a fitness instructor, an entrepreneur, a health and fitness coach, but most importantly, I am a lover of life. And here on the Fitz and Healthy podcast, I intend to give you a ton of great information and knowledge that will serve as potential power so that you can live a life by design and make it more fits and healthy. And don't forget to listen to the disclaimer at the end. I'm not your doctor, yo. All right, enjoy the episode. Much love. Ciao. Hello and welcome to the Fitz and Healthy podcast. I am your host, Dr. Lauren Fitz. And I am joined by my lovely co-host, Cinthanie from Cinthanie.com. What's up, girl?
Hey, girl, how you doing?
You know. And I am also joined by someone super special to my heart. And many of the Club Fitz Fitness fans actually already know who you are. Let's welcome to the show, Chrisonce himself.
Hi.
His real name is not actually Chrisonce, it's Chris, but it's weird calling you Chris because I never call you Chris. It's just Chrisonce.
Like I said, Lauren introduced you to me as Chrisonce, so I legit thought that was your name.
A lot of people
that's a
feel
cool
that
name.
way.
That's saucy.
Yes, I agree.
And the reason why I'm not going to interview every super fan of Club Fitz, but the reason why I have you on today's show is because we are going to talk about the exotic topic of health insurance.
Yep.
I know, right?
Exotic indeed.
No, but this is I always want people to walk away from listening to the Fitz and Healthy podcast with something that helps them in life. And sometimes that's learning something about nutrition. Sometimes that's learning about how to face the things that are holding them back. Sometimes it's gaining knowledge that helps them stay away from getting into huge debt from something like a medical crisis, right? Yeah. But before we start talking about anything special, I just need to show the people that are watching on our podcast channel, the Fitz and Healthy YouTube channel, my shirt that I'm wearing today. Do you guys see that? So Cinthanie was like, does your shirt say Chrisonce? And for those that are just listening on podcast, yes, it does. So there's a story. So I back December 2015. Now, Chrisonce, did you just send this to me just for Christmas, or was it because I had surgery?
No, I was sending it to you for a Christmas gift. And then when everything had happened, I was like, oh, this will just be just like the right time, like it just
timing
melted with the timing. So,
absolutely.
Yeah.
So for listeners who are new to and don't even know what I'm talking about when I say Club Fitz. So Club Fitz is my brand of dance fitness that a lot of people find me via my YouTube channel called Club Fitz Fitness, where it's my own unique brand of hip hop dance fitness. And right now we have like 318,000 subscribers on the YouTube channel. And that's where a lot of people initially find me, including Chrisonce. And, a lot of people find me that are either Zumba instructors or some sort of dance fitness instructor because they're looking for choreography so that they can teach in their own class. And that's how you found me, right, Chrisonce? Okay. And it's very cool because, social media is crazy. It makes it's such a small world because it makes someone that literally you were just a crazy fan. I mean, let's just be honest. It makes a relationship like, oh my gosh, I'm fangirling out when I meet so-and-so to we're now friends. And I truly call you a friend because you are a friend. But the first time you met me was Orlando. Right?
Yeah.
So I did what's called a master class. And for those of you that are like completely clueless to what dance fitness world is when a master class is when someone basically holds this extra special it's usually 90 minutes to 2 hours. That one was 2 hours. And it was in Orlando. We had like 500 plus people at that thing. It was awesome in August. And I love it because it's no different than the dance fitness class that I teach just where I live, but the energy is crazy, and people, fans that are close to whatever city you're doing it at, get to meet you. And this person they've only been following on YouTube all of a sudden becomes real, and you realize like, she's actually kind of cool, right? but I'll never forget, dude, like it was so sweet when I first met you. Like you were like so excited, you were shaking. Like I remember hugging you and you were like, oh my gosh. and now this is like 2.5 years later, and we're I'm freaking interviewing you on my podcast. And so the shirt he sent to me, so December 2015 was really a low point in my life. For listeners who don't know my story, long story short, I gave up anesthesia literally. It was December 2015. That was when I told my anesthesia department, don't schedule me any more cases. I'm going to pursue health and fitness totally full time. So that means my two businesses of clubfitsfitness.com and health and fitness coaching. And things were going awesome. And then all of a sudden I completely blew out my right knee. I had no ACL and a huge meniscal tear, and needed a major surgery in which I was going to be on crutches for 2 months. And it usually takes a year to get back to baseline, 6 months before you can exercise again. Like it was a devastating hit, not to mention the fact that 3 days after my surgery, in fact, I hadn't thought about this. The last time I wore this shirt, we're not going to go here on this particular podcast, but
another day.
Another day. But I will tell my own story, because a lot of people don't realize that Christmas Eve. So I had surgery Tuesday, December 22nd, and 2 days later on December 24th, Christmas Eve, is when I took a picture, because I just got your shirt that you sent me in the mail. You sent one to me and Kelsey. I had my brace on. I was, post-op day 3. Kelsey and I were both wearing our shirts in my bed. And that same night was the night that everything changed, because my now ex-husband, he didn't come home that night. And long story short, he got a DUI, and that led to me finally standing up for myself and saying, I'm not going to live married to an alcoholic the rest of my life. And praise Jesus, I think he is still sober to this day. Thank goodness, he's a good man. But alcoholism, it's something that we will talk about on one full episode of Fitz and Healthy podcast. That's not the point of this, but that's the last time I wore this shirt.
Aww.
Yeah, I know. So I celebrate it now, 16, 17 months later, because I am, I'm a much happier person.
Place.
Yes.
I'm in a very different place,
I see.
And I'm empowered, and so that's, long story short, you are special to me.
Aww.
And I'm very, very happy that you're here spending your day with us so that we can interview you and talk about a topic that affects everyone. I don't care how old you are, how young you are, what your history is, how healthy or not healthy you are. But it's something that I think a lot of people try and ignore, but if you ignore it, it can bite you in the butt in such a huge way.
Yes.
And it's health insurance. And so usually when I interview people, Cinthanie is not on board, but Cinthanie, you are specifically on board today because you are going to represent the person, the person that is not in the medical field and not on the health insurance side. So
because I know absolutely nothing about this topic. I asked Lauren,
okay.
so just a little sidebar. I asked Lauren and Chris for like a little bit of a briefing before we started on this, because we talked about in our episode before this how Lauren just kind of has me jump through hoops when it comes to topics. So I asked for a briefing on this. I asked her a briefing on this, and she starts going through this long list of things, and I was like, got it. let's do it. Got it. So, I know nothing about, which I worked in the medical field for 6 years in the dental office, but I still don't know anything about insurance. So
Right.
I'm excited to be enlightened today.
For sure.
Yeah.
So, my actual first experience with health insurance was actually not as a doctor, but when I was in college, one of my jobs that I had was I was a medical assistant at this orthopedic surgeon's clinic, Sports Performance International. And this was an orthopedic surgeon that I totally got the job because my mom used to be his girlfriend back like in junior high. Not even kidding.
I mean, hey.
Not even kidding. Shout out to Dr. Ted Spears in Austin, Texas. If you're still practicing medicine, loved working for you. Yeah, no, because I was pre-med, and to get into med school, it's more than just good grades and MCAT score. You have to show that you're an overall well-rounded student. And so, having a job that was in the medical field was an important part. Right. And so my mom was like, well, an old boyfriend of mine from Abilene, I think is an orthopedic surgeon down there. Let me check. And so got me hooked up. And so I had zero training for medical assistant, whatever I did, but I was baptized by fire. And that was my first experience with health insurance and how terrible it is, and how it's this beast that can just be confusing. It can be scary, and it can ruin your life if you don't know a lot of things that you're going to be learning on today's episode. So obviously, well, not obviously, but if you've listened up to this point, you know that I actually am a medical doctor. I haven't practiced since December of 2015, but I've been medical school started in 2005. No, I graduated from medical school in 2005. God, I'm old. Sorry. Not old. No. But it, I started med school in 2001, finished residency for anesthesiology in 2009, and then practiced from 2009 to 2015. And said enough is enough. And health insurance is definitely one of the reasons why I hated practicing medicine. And as a physician, you guys are going to get to hear my side of the story. But Chrisonce, tell us why you are even on this call, if you will.
Why you here?
Why you here, boy?
Why am I here? Well, thanks for having me. And you're such a special person in my life too.
Aww.
You are.
No, guys are so cute.
I love her.
He's my boo.
It's official.
She's such a great person
you heard
to
it here
listen
first.
to.
He calls me his onse. He calls me his onse, just for the record. No one else can be your onse. It's me.
Right.
It's me and only me.
She's the only one. I don't call it anybody else. Seriously.
That's awesome.
And I'm so happy. But
yeah, and for those of you that don't know, he loves Beyonce, so that's like a huge compliment to call me his onse. So yeah.
I've been called this name, Chrisonce, for since 2009. It's
no
been
way. That's awesome.
Yeah,
so cool.
Around like the latter part of 2009, and then, but I've always loved like Destiny's Child, and then I eventually fell in love with. I always loved Queen Bee, but
oh yeah, how can you not? Yeah. I mean, really?
Yeah, she's the best.
Amen.
I mean, she's the best to me. I mean, a lot of other people may not feel that way. I know people who,
but screw
I used
them.
to be one of those people who used to go so defensive about if they said anything bad about her.
Right.
But I kind of moved on from that part of my life. So
okay, good.
You're gonna have haters everywhere.
Amen.
But I thought about this topic the other day, and I was like, I don't know if I want to do, if you're interested in a podcast on it, because, I mean, right now, one of the major hot topics in the news and almost every presidential election cycle is healthcare and health insurance and getting access to it. But the main reason for the call today, for this podcast, is to ease the language, to understand how health insurance affects your life. And I've been in the business for 4 years now, and I've learned so much. A lot of stuff I've learned from the backside of it too, that many people are not aware of, and it's really scary. I came from personally My mom had me when she was 17. I grew up living on Medicaid my whole life. I graduated college in 2012, and a year later, I got a job working for a health insurance company, learning the ins and outs of health insurance through employer groups and a lot of employers for a lot of companies, a lot of big companies. So, you know, I'm only 27. I'm only 27. I had to think about that for a second.
You a baby.
I'm like,
You a baby.
how old am I? But I've been in the business since I was 23, and I struggled a lot because I didn't have the background like you have, Lauren, in terms of like the medical terminology. I struggled a lot with that. I struggled a lot with trying to understand what the problems were that people were facing. So there's a lot of stuff, and and all it really has to do with is communication. It's all about communication at the end of the day. So, you know, and one of the things that I dealt with, you know, on a daily basis were a lot of just simple things, the most simple things that you would think that are really simple, but they're not.
Yep.
Whether if it's just going to the doctor and then you get this bill in the mail that could be like 200, 300, 400 or more, you know, and they don't understand why. So
let's get started with some of the biggest misconceptions in health insurance, because you have worked for the largest health insurance company in the nation right now, correct? Okay. So you have been on the other side, and you have seen all of the things that the layperson who feels overwhelmed by even the concept, like doesn't even know, okay, I think my deductible is this, but I don't know what it covers. Like, let's talk about some of the top 3 misconceptions that the layperson, like Cinthanie, who is representing, present.
I'm like sitting here just ready to soak in everything you're going to tell me.
So let's start there.
All right. So, so I know, I see the eyes.
Yeah, well, just dive in.
Well, you know, one of the very first important things is, you know, you get this card in the mail and, you know, and you think that you're covered. So you go and you call a doctor's office and you schedule an appointment with them, and you go and you see them. And then later down the road, you know, you're told that you're covered, and, or, you know, a lot of misconceptions is that, you know, doctor's offices tell patients that, oh, you know, you're good to go. And later down the road, a bill comes you know, that because the patient expected the doctor to know everything. They expect the doctor's office to know what's covered and what's not covered. And it's quite not true. It's far from being true. And with the way how healthcare has evolved and how it has been reformed since, I would say, probably, you know, I've only been in the business since 2013, but, you know, with, you know, the Affordable Care Act, or Obamacare, that's what people want to know it as, you know, I know that major changes have undergone year by year by year with how the law was implemented and how it was designed. But a lot of people rely too much on the doctor. So that's one of the biggest misconceptions. The other big issue is when you call a doctor's office and you tell them and you ask them, you know, do you accept my insurance? You know, and they say to you, yeah, we accept, you know, you tell them the plan, you know. For example, I had a situation with myself one time. I wanted to go to an urgent care and I was really, really sick.
Okay.
And I called them and I asked them, and I was trying to see if they were in network with my plan.
Okay.
And I couldn't find them. So I called them, and I went there, and I later found out I actually left because they wanted to charge me X amount of dollars when I knew what my benefits were. But they wanted me to pay so much more than what I knew what I was supposed to pay. And I later came to find out that they were actually not in my plan. They were out of network with my plan. Wow. So they wanted to charge, I was only supposed to pay $50.
Okay.
And they wanted to charge me like $160 because they were looking at a different system. But long story short, you know, it just, things like that come with the unexpected.
Right.
Yeah.
So
and for somebody that doesn't know better, I mean, luckily for you in that situation, you knew better, but for somebody that doesn't know better, they're forking over money that they probably in the long run don't have to.
Yeah, exactly. That's the thing. And A lot of it, when I used to talk to people on the phone all the time, was communication. They weren't understanding what I was telling them. So a lot of it is taking the time to explain to them what this means, what this doesn't mean. And a lot of times, even when I still do, like still call doctors' offices, they don't know what I'm talking about. It's
Right.
all about it's all about how much that person knows and really understanding the system. Because for me, I didn't graduate college to become working in this business, but
Right.
I been fortunate enough to learn so much, especially since I used to be someone who lived off of Medicaid. When I was one of those people who did give the card to the doctor and they did everything for me, versus now with, um, employer sponsored insurance for the most part, and that's generally how most people have their insurance through, um, is they expect their doctor to know everything, and that's the downside.
No, and I'm so glad that you made this point, because the fact is, granted, during medical school and residency, I was never at a point where I cared about billing. I mean, I would fill out paperwork for billing, because in training, most residency programs, you're at a county hospital. And so that you have a lot of Medicaid, you have a lot of people on the government provided health insurance. And so,
Right.
but there's still forms you have to fill out. But
Right.
I mean, beyond that, I did what I was told to do. And then I didn't really care, because I'm being paid my salary regardless. But,
Right.
Once a physician is done with residency and they go and, start their own private practice, then they have to start worrying about this. And I will tell you now, granted, my road was a little atypical, because after residency, I worked for the DoD. So I was basically the only civilian doctor at the med group in Misawa, Japan.
Mm-hmm.
So the government was paying me. I really didn't have to worry about, health insurance and whatnot.
Right.
But once I got to the real world back in, returned to the United States and was practicing private practice in Oklahoma, I filled out paperwork for the billing company that my anesthesia group pays big time for, so that they can make sure that they collect everything. And then that's it. And so I would have patients ask me all the time, is that covered? And I'm like, I have no clue.
Yeah.
Yeah.
And that's the downside of it
yeah.
too. And there's things that happen in the doctor's office that are that are not covered within the actual office visit, because the way when the billing is done, if the doctor did a surgery in the office, they're going to bill. If they did an office consultation, they're going to bill for that, and then they're going to bill for the surgery, whatever they did, separately. So depending on what their plan benefits are, the services that they receive apply to the benefits separately, no matter where the service was rendered. So they will have probably a higher patient responsibility because of the ancillary service that they received in the office. And that's what a lot of people don't have a problem. A lot of people who still have co-payment plans, which are probably, they're dying. Those plans are disappearing.
Really?
It's turning a lot into a high deductible health plan now, where you have a health savings account. You put the money in a health savings account. The money is withdrawn out of your paycheck by however you decide to have the money taken out, and it's put into this account so you can use it to pay off your bills,
Right.
for the most part. But the copayment plan, I know sometimes some people used to have like a $20 copay for the office visit, but then they have an outpatient surgery done in the office, which they don't understand. And their benefits say that, they have a $200 deductible they have to meet first. And then whatever the insurance's rate for the doctor for that surgery is in the office will apply to the first $200. And then they may have a $220 bill because of the actual of the office visit and the surgery that they had done.
And they're assuming that they only owe 20.
Yeah.
Because it's a visit.
Yep, and even the doctor's office too is even said it's $20, a lot of times just $20, and then later down they get the explanation of benefits, or it's also known as an EOB,
Right.
and then they'll find out that they were not correct, and then that's when the phone call to the insurance company is made.
And then that's where the bills start racking up.
Yeah. Yes.
And to the average person who lives month to month,
right,
a difference of $200 might not sound like much to me, but it sounds like a lot to the person that literally has their budget down to every single dollar being spent every month.
Yes.
And that is where it becomes a problem.
Yes.
Okay. So what's another big major problem that you see?
Well, one of the other big things is if you go to the doctor's office and they draw lab work out of you, they are testing you for whatever. And if the doctor has a partnership already with a certain lab, they'll do it as a courtesy for you. They'll send your labs to wherever. But the problem that the patient fails to ask is where they're sending the lab works to, because not all health insurance companies are contracted with all of the labs in the world.
Yeah.
You have Quest, you have LabCorp, you have all these independent small labs companies that are not officially contracted with health insurance plans, and the doctor may have a relationship with that office, and they'll send it there. One time I had a phone call from a man in Iowa who just became a member with us through his employer. He went to the doctor was a network. He got a bill for the doctor, but then he also got a $5,000 bill for the lab services because the doctor sent his labs to normal labs, nothing special, nothing you would
serious?
need. Yeah.
Oh,
and they would send it out to
$5,000.
Yeah. $5,000 bill. And they would send it. And the scary part is that, the only thing that the plan could do is, he would have to appeal those charges. But that's the scary part about it, is that a lot of people don't know to ask that question. A lot of times people are intimidated to ask the doctor where to send. I always tell my doctor, this is where it's gotta go, because if you're not on top of your game, unlike someone like me who's been in the field or unless this situation has happened to you already once before, then can get scary, and you don't know exactly how much that those charges are and whether or not what you're going to be paying. So that's what's really scary.
Well, I would guess that most people wouldn't even know to ask.
Yeah, no, I would have never thought.
Yes, that's exactly the thing.
I showed up, I paid my money, I've done my part. Now the doctor that's their responsibility.
Right.
I would never think to ask that.
Yes.
Yeah.
But what I'm seeing a commonality already in your first 2 points is there is a lot of assuming, and you know what they say about assuming. Right. But this is a PG show, so I'm not going to say the A word. No, but it's true though. It's,
true.
People are assuming that the doctor's office has their whole life understood and their life insurance and their not life insurance, their health insurance. And they're just assuming that, okay, that they know. But at the end of the day, it's the patient's responsibility, right?
Yes. And that's what it's turned into. And that's the whole point, I think, about the high deductible health plans is that, the whole point of the high deductible is that you're taking yourself into a situation now where you have to figure out where you're going to get the most for your money. You're going how much you can save.
Right.
Because the whole point is, like, me personally, I have a $1,300 deductible that I have to meet each year.
Right.
And then once that is met, my plan only pays 80%.
Okay.
80% of what the plan's contracted with those doctors I see.
Right.
So then I'm responsible for 20% on top of the 1,300.
Right.
So, and a lot of people don't know that. A lot of people don't understand that. Or a lot of times I see with the big thing is preventive care versus diagnostic care.
Okay.
Preventive care is, well, but it's a huge thing. And a lot of people don't understand it.
So explain the difference.
The difference. So you call your doctor. Well, preventive care is, you call your doctor and you say you want to make a well visit. And then well visit is just to ask you how you're doing and making sure, checking your weight, your height, all the stuff. And then, that's what pretty much is. It's just your average physical. That's it. That's all it is.
Right.
The moment that you start saying that you're not feeling well, or the moment that you are saying, it's just like kind of like a car. And that's how I say to people, if your car is doing pretty well, then that's preventive care. But the moment that your car has X, Y, and Z problems, that's when it's considered diagnostic care. So the moment that you start saying, well, I have a cold, I've been sick, I haven't been sleeping well, that's when it changes from a preventative visit to an actual diagnostic visit. And a lot of people don't understand that. And that goes the same thing for when someone has something done in the office outside an office visit, you know, like a surgery or lab or whatever.
Right. So a patient's understanding of the difference between those two definitions, how does that help a patient?
Well, because it alarms them to not open their mouth when they're in the doctor's office.
So you literally, I just want to make sure I'm understanding this. So if you are at the doctor and you're just there for a routine checkup, but you say, but I've kind of been feeling off a little lately, that changes the charges of the visit?
It could, yes, because what will happen is that the doctor can bill for what was done because they have now they have the notes stating that this is what was discussed.
That you said that,
Yes.
Wow.
And in defense of the doctor, once a patient has said that, you have to address it.
Well,
and this is CYA. I mean, if a patient has told me that they have lost weight without trying, the first thing I think about is cancer. And if they say this to me and I don't do anything about it, it's on me. And if they end up having cancer that I could have helped them diagnose on that visit, then they can actually come back and sue me.
Yeah.
Right.
But it just sounds like it's a situation that nobody benefits from.
Yeah. And I think that this is like the huge disconnect with like our government.
Yes.
The government, because the government is saying this is what's preventative care, and then you have the doctor and the patient so misinformed about what is and what isn't. And it's truly frightening because right now we're at a crisis in our healthcare system. It's a true crisis. I mean, I know with Obamacare, it was the first step to getting people coverage, which is so important because in 2000, I did my numbers, and back in 2010, we were at about 49 million people without health insurance. Now, though, with health insurance is one huge issue itself, but being able to afford it is another.
Right.
Because I see people with $10,000 deductibles, and unless you're making a lot of money, that's what I'm assuming, is that if you got a $10,000 deductible and you're making a lot, you can afford it if you're making a lot of money.
Right.
But if you're someone who has got a $5,000 deductible and they're just making minimum wage, the chances are they're never going to be able to afford to go to the doctor. They're never going to be able to afford to take care of themselves, even if they get sick.
Yeah.
So,
or
that's,
if maybe they get, like, for instance, like pregnancy. I mean,
that too.
You know,
yes.
that people don't realize like how expensive it is to have a baby. And, and, you know, anyone that is a Club Fitz fan knows that my best friend Kelsey's pregnant right now. And, you know, that it was an unplanned pregnancy. She and her husband have two beautiful girls that are 9 and 7, and they were done. But we had a little surprise third kid on the way. but I mean, it does. And you have to, you know, luckily they're in a state where, okay, we can do it. But I mean, their deductible, like everything that has to come out of their pocket before the insurance company starts to pay for anything. I mean, it's pretty large. And that's, you know, I just think about all of the people that accidentally get into that situation that they're not planning for it. And then all of a sudden, they're faced with, wait, you want how much money to come out of my pocket before?
And that's another issue too, because deductible is a huge thing. The largest and again, it's communication with the doctor's office and the insurance company, because when someone's situation like pregnancy, for example, they have or a surgery or whatever, and that's usually where the benefits apply to first.
Right.
The insurance companies are the ones that apply how much you should be paying towards your deductible to the doctor, not the doctor, because a lot of times is that if you got a $2,000 deductible, and let's say, for example, you pay the $2,000 to the doctor, but then you get a $2,000 bill from the hospital or the surgery center or wherever, you pay the wrong person, because according to the EOB on the statement, the insurance company, depending on which claim got to the insurance company first, they're going to apply whatever you didn't pay towards your deductible based on what your plan says that you're supposed to pay.
Wow.
And then that's where the biggest, so then you have to call the doctor's office. you have to get reimbursed from the doctor for whatever that you're supposed to get reimbursed the difference from what you're supposed to pay the doctor to what you originally overpaid them. It even happened with me with my dentist, and I love my dentist, don't get me wrong,
Of course,
by all means, but they sometimes providers will overbill. They will they overbill you, and they just don't know, and that's okay. And then there's some doctors who are more cooperative in working with you on that versus not working with you at all and never telling you. And that's a lot of things. That's what happens a lot of times too, is the doctor's office will never let their patients know that they overpaid, because they'll be like, I already paid my doctor this amount of money. Why am I getting this bill? And that's what we have to explain to them. And that's what's frightening. And it's very overwhelming. And sometimes when I used to come home from work, it would be very, very discouraging, just because of seeing such the disconnect. And you have to call the doctor's office, and you have to, but the billing, it's a one thing after the other, and it just drives me insane.
Especially because a lot of these people are probably already in a distressed state because they're dealing with some kind of ailment. And then putting the financial burden on top of that, you probably get the short end of the stick on a lot of situations. Their frustration probably comes out at that point.
But all of this goes back. We just recorded an episode talking about excuses are like a-holes. Notice I said a-holes and not, you know what. but the fact is that ultimately this is an excuse that the patient and most patients are making. It's an excuse. Well, I didn't know. But at the end of the day, it's their responsibility. It is not the fault of the doctor or the doctor's office, their staff, even the insurance companies, as big, bad, and ugly as they are. The fact is, too many patients just don't know, and they don't empower themselves. And so they put themselves in a position. And then when they're in that position, they're like, well,
this sucks.
And I mean, some people go as far as having to, file for bankruptcy, and like it literally can ruin their life. And at the end of the day, if they would have just taken time to empower themselves with knowledge, hashtag knowledge is potential power in all aspects,
make an educated decision.
Yes, because the fact is that I can speak for the doctor side of it, that like, I hate health insurance companies. I hate them because the fact, like, I haven't practiced medicine since November 2015. I literally just last month got a check from the billing company for the anesthesia department that I used to work with. And that was almost 2 years after a service that I rendered a long time ago. Like, people think that doctors are the villains in this, that they're just making all the money. And the fact is, no. It's the CEOs of these insurance companies and the CEOs of these hospitals. If you look statistically speaking, doctors don't make what they used to. And for people always forget about the fact that to get through med school and residency, most doctors accrue at least $200,000 to $250,000 in debt. And so once you start, you're already so far behind, and you have to work to pay off that debt so you're not in debt the rest of your life. And so people vilify physicians all the time. And even though I'm not practicing medicine anymore, this is part of the reason that I wanted to get out, because the crisis that you're talking about, Chrisonce, of our healthcare system makes people in healthcare miserable. And this is, I mean, truly, like, I liked the interaction that I had with patients. I loved the fact that I could take someone that was so nervous about the surgery they were about to have, and my 15-20 minute interaction with them before surgery, I have the power to calm them. And you know what? But I don't miss all of the other stuff that comes along with practicing medicine. And unfortunately, it's kind of like teachers go into teaching because they love kids and they love helping, but so many teachers get out of it because the education system is so jacked in the end that the bad outweighs the good. And
the bureaucracy.
It's the bureaucracy. But at the end of the day, understanding the patient has to be empowered with knowledge. And our culture is all about instant gratification, and we've got no attention span whatsoever. So people would much rather Netflix and chill and
Yeah, and that's where we led to a society, especially with technology now, how we just expect technology to do everything for us. We expect the doctor to do the same thing, and it's not that at all. It's scary. The biggest thing I also see too is emergency rooms. You go to the emergency room, and the hospital will bill for it's one thing, and then the doctor would bill for the other, and then the doctor would be out of network, and the doctor would the doctor's bill would be 10 times more higher, just because they're billing entirely separate from the hospital. And I'm assuming the doctor doesn't know that. The doctor that the person who actually received care from doesn't know that.
No.
They're receiving, just like how you just said, they're just getting paid what their salary is.
Exactly.
And the whole billing company has decided that they don't want to work with insurance companies, so they're going to do what they go through the loophole.
Yeah.
That's a loophole. That's a huge loophole in terms of how people get screwed over, and that's one of the reasons why people end up filing bankruptcy, because of things like that. And it breaks my heart.
So what happens to the trauma victim that is in a bad car wreck, that loses consciousness, that's picked up by the ambulance who basically takes them to the level 1 trauma center that's on call for that night, and then all of a sudden they get there and their insurance doesn't cover? Like what happens to that person? Because you get to deal with them after them, assuming they survive.
Right, of course. Well, I will say, based on my experience, what we used to tell people, and I know that this still goes on, but used to tell people the only thing that you can do is file an appeal or a dispute, because once you do that, it's on paper, but it doesn't guarantee that the actual claim will get paid. It just knows that you're disputing the services because of X, Y, and Z reasons.
Mm-hmm.
You went to the emergency room, you did this, you did everything that you're supposed to do.
Right.
And then you get this $3,000 or whatever bill in the mail for the doctor's charge that you're not able to afford to pay.
Right.
And that's pretty much what we used to be able to do. Now, I don't know in terms of how that's changed or not, because I transitioned from that one role. I was for 3 years. I was in customer service for 3 years, and it was rough. It was rough, and I did it because I learned so much. And I got to be able to take that knowledge, and I can share it with so many people now because of what I know. And it's like one of the best things ever, to educate people on something that you never really had a passion for ever in your life, and to actually see how much it can become, like how much it can influence. Like and I'm doing a master's program. So one of the things I would love to do once I am done, and that would be a couple years, but I would love to work on policy so that legislators understand better how this actually works, because there's a huge disconnect. They don't know either. We call our elected officials and we tell them the issues, but they still don't understand. But when you got someone like me who does, it makes a whole ballpark of a difference. And there's a lot of people in the industry that know a lot of what I know. But I don't know if they're as vocal about it. I think they usually just go home and have a good glass of wine the other day.
Exactly. So if you could have your own TV show on PBS where you are strictly giving helpful advice to the public, what are some of the major topics that you would talk about that you would want to empower people with?
Oh gosh, so much, but I would love to do a lot of things we talked about. Understanding preventative care, understand what to do as a patient, knowing that it's in your power to know what questions to ask when you're at the doctor's office, because you don't know exactly what's going to happen later down the road. Calling your insurance company before you go to the doctor's office, understanding what the words in-network versus out-of-network means, knowing that there's a difference, knowing that when you go to an in-network doctor, they have a contract versus an out-of-network doctor doesn't, knowing the words accept versus if they are contracted, because there's a huge difference. Just things to just keep your mindset be aware of. And there's always something new. There's always something new about what in the healthcare system that a lot of people don't realize. And I think more topics would go on as more issues, because I think as the years go by, we're going to see a lot more issues, especially now that, you know, there's lots of talks that the healthcare system could potentially be changed again.
Okay.
So, right, but those are a lot of the things. What happens when you go to the emergency room, how the emergency room is not your doctor's office, and how it really could affect you. So those are like hot topics. Like those are really hot key health insurance topics. I would love to go and spread about. I would love to go around the country.
Yeah.
You know how you do master classes?
Uh-huh.
I would love to do like
Chrisonce workshops.
Healthcare master class.
Master health insurance master classes.
Yeah.
Nice.
Awesome. It's
the
coined,
fun way.
it's official,
Right.
it's gonna happen.
Right.
In the
You would
most
dance on
simple
your
terms.
breaks. Right?
Yes, exactly. We'll have single ladies on, you know, while we're
Exactly.
But I would love to do that. That's like something that, and it's just a huge knowledge deficit. That's what it is, between even with the doctors too. And I know doctors are not taught health insurance in medical school at all, because clearly,
definitely not.
Clearly, there's a huge disconnect with them too.
Yes, definitely. Okay, so let's talk to the patient like Cinthanie. So you have someone who is young and healthy, who doesn't have any medical problems, but probably, I'm assuming this, but you probably have no clue what is covered by your insurance.
Yeah.
Right?
No.
Okay, so I assumed correctly. So where does someone like her start?
Yeah.
Well, first thing I would do is, you know, I would probably ask her, you know, do you have a doctor that you want to see? First thing of all thing is pick up that phone, call the number in the back of your health card and call health insurance card and speak with someone, because the things we should be asking is, do you have a doctor? Did you verify if that doctor is in network? Why are you going to the doctor? Going for whatever X, Y, and Z reason, telling you what the benefits are pertaining to the services that you're going to receive, and that should be it. And then following that, if anything else were to happen outside of our conversation, you should probably give a call back, just because if the doctor said, you know, well, I have this order to go to this lab, you know, or this doctor, if the doctor refers you to somebody, a specialist, that doesn't mean that they are in network with your plan either. That means that they are a lot of times anymore, referrals are no longer needed either. But and that's what the problem with that too is that, you know, you go to someone that you're being referred to, but that doctor could be out of network.
Yeah.
So what people should know is that they should always be doing the first phone call, get the name of the person you spoke with and a reference number, so that you have that as documentation.
Yeah.
Don't just put it on a little Post-it note.
No,
like, put it somewhere
put it somewhere safe. Store it in your phone. Store something that you're going to use all the time and that you're going to look back at. And just making sure that you have that you do your research. That is like huge. And there's still things that insurance companies still make that are out of control, even with the person who's doing all that research too.
For example?
For example, the claim may not process correctly. It may process with the, process out of network by mistake and versus in network. So sometimes it just takes one phone call to get that fixed.
Okay.
I know that for me, I had an issue last year. I had a different plan where I needed referrals, but I saw my pulmonologist back in around December. Okay. And my claim had denied because I was trying to get an authorization for electronic referral, but it wasn't going through.
Okay.
So so the claim denied because I didn't have that, but I was able just to call them. I called my doctor's office. They faxed over what I needed, and we got the claim reprocessed. And sometimes it just takes something simple like that.
Yeah.
But major things, like, got to ask those really important questions. Why are you going to the doctor? Who are you seeing? When are you seeing them? Is your plan effective? Is it not? You know, that's like huge. Those are, and people don't know to ask that. Yeah. That's just, and I think that's normal for people to not know that. You know,
or they ask the wrong party. They ask the doctor's office.
Yeah, that too. Yeah, not ask. Don't rely on your doctor. That's for sure. I mean, as much as you may love your doctor, I strongly recommend you got to, like you always say. I remember watching one of your Facebook lives or back when it was still
one of the many times I talk.
One of the many times you go live. I always
Talking McTalkerson here.
When you talking when I'm listening to you, I'm like, gosh, I just want to like tell her what I know too.
Yeah.
But but it's like do your research. Like when your doctor refers you to someone, look them up.
Yes.
And
because not all doctors are created equal.
Exactly. Not all doctors, and sometimes you're referring that doctor. If that patient's being referred to someone that your doctor knows, and they're taking your business. Exactly. You're hiring them to help you with your health.
Yeah.
So do you maybe you should reach out more. And do more research and figure out.
Ultimately, it falls on the patient, because the reality is, medicine in our country is a business, and no fault of because obviously I'm speaking for the doctors, but I was married to an orthopedic surgeon, and the fact is, if he doesn't have patients, he doesn't get paid, just like any other doctor. And all of us, unless you were given a whole lot of money, a trust fund, most doctors graduate residency, medical school with huge debt. You have to defer it because you don't make crap during residency. And then all of a sudden you're meant to practice on your own. And the fact is that I scratch your back, you scratch my back. So surgeons don't get patients to surgerize unless they have relationships with family practice, internal medicine. But the fact is, I've told my friends and family this on multiple occasions. Not all doctors are created equal. So don't just assume that the surgeon that you're being referred to is the best person for you, because it might be the person that's scratching that person's back. And so do your research. I always tell people, as far as surgery goes, I want to go to the person that the people that work in the OR want to go to. Like whether it's your gallbladder, or plastic surgery or whatever, you don't want to go to the person that, I went to them. Well, who are you? We get to see the surgeon who cuts corners versus the one who always does the right thing when no one's watching. Not and that's the same way with surgeons, with nurses, with anyone. There are good and bad of everyone, but at the end of the day, it falls on the responsibility of the patient. And there's so many times that I hear a patient have regret, like, oh, I wish I would have known. But the fact is, so many people are lazy when it comes to educating themselves.
Oh yeah. I remember I used to deal with some people who used to call like all the time, like I gotta call, do everything, like, and there are some people who are by the book, in network only, like it's got to be in network or I'm not going at all, like. And then there's some people who would be like, I'll go out of network and I'll pay the extra money because it might be worth it for me. But there's some people who are like, in network only, I don't want to deal with none of that red tape. Let me get, and you know what? And that's me personally. Like, I got to be in network. Like I make sure I do all my research and I'm good to go. For some other people, they don't, and a lot of it comes to be apathy, laziness, but there's just some people who are young or not even young. It's all age brackets. It's all people from all walks of life who don't know this stuff, and you know what, and that's okay, but it's my job. I think it's our society's job to inform each other of this stuff. Because really at the end of the day, this is going to keep going on, and unless someone actually does something about it, the issue will continue to escalate, and that's where our crisis will continue to bloom.
And people will take advantage of you just assuming the I didn't know role. And like I think about back to when I had my ACL surgery. So I've always, I was married to my ex-husband who was military. So I had military insurance, and I almost never, doctors were the worst. We don't go to the doctor ourselves. So, I never needed to use my health insurance. And now all of a sudden I needed to. And, there was one particular thing in which I just asked for refills. So it's this little machine that basically does muscle contraction. And I needed more sticky pads. And so I called the rep because she gave me her number. And I called the rep and I'm like, can I get some more of those? And ended up being charged a huge amount
Yeah.
they kept sending them to me. And I'm like, I just asked for one thing. But the fact is that I was totally taken advantage of. She didn't tell me, oh yeah, we can send it to you for this much more money, because your insurance company is not going to, and it's ultimately it's on my or on my back because I didn't ask. But again, medicine it's a business. And
I think a lot of people don't realize that. They don't realize that it is a business. They don't.
Yeah, they don't. I remember, going to, because I know like some doctors who do take Medicaid patients, well, and they have office hours on the weekend. They will not take those patients on the weekend because they don't get paid as much as commercial insurance plans do. And that's a huge issue too. I don't think that, that the government needs to get involved in every issue like that. But the loopholes that these companies, or I should say that, doctors and everybody, I should say, everyone's accountable at the end of the day, but these loopholes that that are taken do go back right to the bottom, and that's the patient, and that's what's huge crisis.
And like talking about it still gives me angst. I'm so grateful that I don't have to worry about this every day, because truly this is something that when you are in healthcare, whether you're on your side or the medical side, you are faced daily with, and it can just make you a bitter person. It can just create unnecessary anxiety. But like when I think about the healthcare crisis, and what's the answer? Like, I don't even know where to begin, because it's so far down the toilet. Like, how do you go about starting to save such an unhealthy system? Because the reality is, if the individual person could start taking responsibility for their health, that would be the biggest reversal of that toilet circling, and we would start to come up. But our society is all about, well, it's their fault, it's their fault, it's their fault, and they never point at themselves and look at like, well, you know what, if I wouldn't have eaten McDonald's every day for the past 20 years, I might not need to be getting my toes chopped off right now, because I've let my type 2 diabetes just run rampant. And I might not need to be in the ICU accumulating tens of thousands of dollars every day if I would have just taken care of my own health a long time ago. And then there's people like me who I have always taken my health, been responsible for my health. And it's a frustrating system. I don't know. I don't know the answer.
It bites. I want, like, the stress comes with like wanting to bite my fingers off. That's what it comes down to. Because not to get political, but long story short, with the system that we have
I don't do politics, Chrisonce.
No, I know. That's not what I'm going.
I hate them both. They're all liars.
I just. Oh, I love the politics thing. But long story short. Instead of trying to redo the whole thing over again, I think that it's better to work with what we have and trying to fix that. Because once you dismantle something, it's just like when you take apart you take apart a device or something. And you want to put it back together. You may not put it back together the same way. And you may have a missing piece or something. And I think the issue is that, I know the first portion 7 years ago was, that, we needed to get people with insurance. But the next thing is now how do we dive into the issues that we've just talked about for almost the last hour? You know what I mean?
Well, so, but honestly, the thing that's going to save our country is not going to happen, because there's too much money to be lost from big food.
I agree.
And big pharmaceutical, because everyone's pockets are lined in politics by big food. Exactly.
Lobbyists. Lobbyists.
And they don't want voices like ours to be heard. So that the average person, because it never ceases to amaze me when I talk to a person that really doesn't understand that the food they are feeding their body is poison. Food companies, big pharmaceutical companies don't want them to recognize that.
Yeah.
Right.
And even if they do, so many of them are basically brainwashed, and that literally brainwashed, because the food that you're eating is sending chemicals to your body saying, oh, I crave more. And you go back and you buy those Oreos again, and you drink that soda again. And I mean, it's the perfect business model if you're the owner of Coca-Cola or Monsanto. I mean, there's so many big Oh, I don't want to get on that soapbox, but
I know.
but that's the fact. So we can't rely on our government, because it's not going to happen. The only way that we can start to barely reverse this crisis is with the individual and stop buying it.
Stop buying it.
Just being empowered, making a educated decision on what you can do to be on the preventative side of this, so that you don't have to in 10 years go, well, I don't have insurance, but I have a lot of health problems and now I have to get insurance, but these are all pre-existing conditions. It's like the best thing that you can do is to be preventative. Act now and not when you need medical care.
I agree with you, Cinthanie. It's a big circle, food industry, get sick.
Oh, I could talk about this all day.
I know. It's a great
it's a horrible cycle.
It is. And God,
when there's
the rage
corruption
in me.
There's corruption in all aspects. I mean, because for every physician that gives every doctor that cares about their patient, there is that doctor that will totally justify it in their head, like, you know what, I'm going to charge them. They don't realize that they're going to get charged for this, but I don't care, because they didn't spend all of those hours during residency training and they haven't sacrificed. And so they justify it in their head so that they can go to sleep at night and they have no problems. So there's corruption in every single aspect. And when it comes down
the
to
whole game,
greed,
I think our country is full of that.
But it's because people don't care to make the decision for themselves anymore. People are not empowered enough to do the research and figure out what the best decision is for themselves. They so badly want to be taken care of by someone else, something else. They want to be taken care of. They don't want to have to do take the guesswork out of it. Just give me the easiest option, quickest fix. People don't want to. This is probably a podcast that we could talk for hours and hours and hours I do
about.
have a question though. This is a little bit, I mean, it's on topic, but a little bit off. So let's say you are a person that neither has government assistance or medical insurance provided by their employer. What do you suggest is the best way to go about finding medical insurance for yourself?
That's a great question.
Well, I mean, currently there are the exchanges, and probably have to check with your state. Also,
so what's the exchanges? Like that.
I'm sorry. The exchanges are the part of Obamacare was that they allowed the government to open up options through insurance companies to purchase insurance 9 times out of 10 for a subsidized cost. So you would, if your income is where it needs to be, you would receive a subsidy to help pay for your insurance. Reduce.
And is that government assisted?
That I would. So first thing I would do is check with the state. I would check with your state to see what options you have. Because if you're depending on your
somebody go to check with their state.
They probably would want to go to their social services office, probably work with someone there so they can verify whether or not they are eligible to receive possibly Medicaid through their state. The second best thing is through the exchanges, which is allows them to purchase a plan, and if their income qualifies them, they may receive a subsidy. That's on healthcare.gov. Also too, if you lost a job and you wanted to continue your employer's benefits, there's something known as COBRA, which is very expensive though. It allows you to continue your health insurance, but the cost is basically you're paying what you would normally pay plus what your employer was paying at the subsidized rate. So it's very much more expensive, and you're only allowed to be on that for a certain period of time. So those are just some of the options I would do for someone. And also too, sometimes there are doctors that do work with patients who are cash paying, so they will reduce the costs at the office if you're a cash paying customer. So that's also to another thing as well. Those are some of the options I would do.
See, I've had to deal with this in the last year because you know,
as an entrepreneur, when you work for yourself,
and for those of listeners who don't know, in 2016 I went through divorce, so I have been on, you know, the military health insurance for the longest time, and I had to actually. I will admit that I went many months without health insurance. I'm one of those guilty people. Like, guilty. I'm just gonna hope that nothing happens. And and honestly, once
I'm one of those too.
I know it's terrible, but you know, and I'm lucky that nothing happened. But during those months that it was essentially out of sight, out of mind, and it was in the back of my head, like, when I thought about it, kind of gave me angst, like, if anything bad happened, I would be, you know what? But the fact is, I actually, the place that I teach 2 days a week for the gym, they offer benefits, and I'm like, perfect, excellent.
Wow,
I'll just take them off.
That's awesome.
I know.
That's cool.
But actually, you know, because I hired my Leah, my assistant, full time, and so she left her job, which she worked for actually a major, a big company. And she was faced with Cobra, and she looked into those prices, and she was like, OMG. Yes. So and you know, I mean, she's a young and healthy person, you know, in her mid 20s, and the prices, like, it's just, it
frustrating.
Makes my stomach hurt to think about everything that, like, we're just so far gone. It's not even funny. And, but if anything, I want people to walk away from this episode, knowing that, one, you do have the power, but you have to take it. And it does take some time, and it does take some effort. But it, just like Chrisonce said, it starts with a phone call to your insurance company and getting knowledge. What is covered, what is not, where can I go, what kind of questions, like you said, the 3 W or the 5 W's, and the how, what, when, where, why, how, like, knowing that information can save you time, money, and a lot of heartbreak. I mean, Chrisonce, you said that you've cried on the phone with plenty of patients. I mean, I can only imagine some of the heartbreaking stories that you have.
Unrecorded calls.
Can you share one with us real fast?
Yeah, of course.
Obviously not sharing names, but
no, of course. No, I just remember one time this lady called with her husband trying to get her husband's specialty medication at a pharmacy.
Okay.
And they were calling like constantly because they weren't getting any help from anybody. Now, mind you, you're going to get people that you call anywhere, and they're not going to help you. Right. They're not going to care about the job that they're doing. They're just only there to collect a paycheck, and you'll notice the difference. I remember being able to figure out why she couldn't get it, and I was on the phone till almost 8. I was supposed to be there till 8 o'clock anyway, but I was there for the majority. I was on the phone with her for about over an hour, going back and forth with her and the insurance, trying to figure out, because at the time I didn't see everything that went on with the pharmacy side. I see, but because I don't have those I didn't have access to those systems. But I was able to go ahead and get the issue resolved because I knew exactly what the issue was. And I remember when this was. I think it was last year. It had to be last year or the year. It was last year, right before I transitioned to my new role. Okay. But I remember helping this lady, and she was crying on the phone, and I was crying. We were on the phone for 50 minutes. Actually, it was less than an hour. It was like 50 minutes. And it was just so heartbreaking because it was a life or death medication.
Yeah.
And it was by the time we were getting ready to close. And I just was like, I got to do this.
Yeah.
And I've even stayed past and other times to help people try to get their medications because of a system error and stuff like that. And just because I could imagine if that was someone like my mom or someone, or someone close to me. and seeing that happen to them, and she was crying on the phone. I'm like, you're so welcome. I just think about it now because I start getting emotional and I think about some people like that, but that's what the rewarding part is at the end of the day when you got someone who's like, someone, or especially the worst people to call are the condescending people. The people who are just so nasty and you're trying to help them, but they won't take it from anybody. But the people like that who I can help and who are open and taking the information in is truly the best thing on all of it. So that's the one thing I do want people to take away too is, just know that there is someone out there that does. And they even said too, like, it probably could have taken me all these times just to get you, So
now they're going to always request Chrisonce.
Not anymore, unfortunately. But it was a true blessing to help somebody. And those were the moments. And there's other moments too. I've helped people, but I just remember that one particularly.
And, people like you in this world, give me hope, because there are people that do the right thing when no one's watching. And I've preached this from my first talking video on my YouTube channel to today that, just bring positivity to this world. There's so much negativity and hate and treat other people the way you want to be treated. And, but empower yourself, because no one is going to take care of you like you. And if you take the role of, I didn't know, it's only going to hurt you in the end.
You can't play victim.
No. So anyway, I appreciate you taking your time.
Thanks for having me. I love you so much. Thanks, Cinthanie. I love you. I do. You guys are so awesome, and I'm so happy for you. I really am.
Love fest.
I love time.
Stop it some more.
This was great. It really was.
Excellent. Well, I hope that our listeners can walk away from this episode feeling empowered, knowing that, okay, this topic, it's still overwhelming, but it doesn't have to be overwhelming.
Right.
And that first step to overcoming the unknown is by you taking control of your own situation and empowering yourself with knowledge. That needs to be the underlying theme of pretty much everything we say. Knowledge.
I think it is. Seriously,
really
in every episode,
potential power. It's power, girl. That's what it is. Especially when I be talking to the doctor's office, they be like,
"Oh boy,
what?"
I love it.
They'll be like, "You know more than we do." I'm like, "That's right, because I know my stuff."
All right. Well, thank you so much for listening to this episode of the Fitz and Healthy podcast. Cinthanie, you have a message for him, yes?
I do. You are a good person and you deserve good things to happen to you.
Thank you guys for listening to this episode of Fitz and Healthy. Make sure that you go subscribe to the podcast, whatever platform that you listen to us on. Go download the episodes and please leave us a review, because we read every single review and we want to know what you want to hear. Much love. Have a Fitz and Healthy day. Bye.
Bye.
Make sure that you find us on social media. You can find Cinthanie on Instagram and Facebook at Cinthanie. So that's CINTHANIE, and on Snapchat at Cinthanie P. And find me on social media platforms like Instagram, Facebook, and Twitter, all at Club Fitz Fitness. Remember, that's FITZ Fitness. And on Snapchat, just at Club Fitz. I appreciate your time listening so much. If you enjoyed this episode of the Fitz and Healthy podcast, can you please go do me a favor and go subscribe at whatever platform that it is that you listen to podcasts. Leave a review. We read every single review and we appreciate the time that you take to leave your thoughts and opinions. Now, also remember, while I am a medical doctor, the information I provide here is not intended to provide medical advice or a professional diagnosis, opinion, treatment, or services to you or to any other individual. I am providing general information for educational and informational purposes only, and it is not a substitute for medical or professional care. You should not use this information in place of a visit, call, consultation, or the advice of your physician or other healthcare provider. The information I share is not intended to treat, cure, or diagnose any disease or medical condition. If you believe you have a medical emergency, just call 911 immediately or your physician. Now, enough of that medical legal jargon. Thank you so much for listening to this podcast. I appreciate your time. Now go live a Fitz and healthy life.